Hello all. Very good morning to all of you who all are present over here. I myself, Dr. Krishna Vagela from the ARIP University, welcomes you all on behalf of the ARIP family. So today, once again, we all are gathered here for a very informative and wonderful session, which will be delivered by our proud alumni, Dr. Pranav Kshatriya. So I would like to first introduce our proud alumni, Dr. Pranav Kshatriya. He is a proud alumni of ARIP batch 2015. He graduated BPT from ARIP Charusat-2023 and then he did the masters in the public health from the Symbiosis International, which is located in the Pune, Maharashtra. And then he got the first rank over the particular university and awarded University Merit Scholarship at that duration. Currently, he is working as a research assistant in UNICEF, that is the United Nations International Children's Fund. They funded health economics project at the Department of Community Medicine, School of Public Health. And right now, the Dr. Pranav, he is a member of the Indian Public Health Association as well as the member of the Epidemiology Foundation of the India. And he has various publications in the reputed journal as well. So over to you, Dr. Pranav.
Yes. Hello, everyone. Thank you for the wonderful introduction, Dr. Krishna. Now, I will be talking about brief about public health. So there is no need to introduce me as it's already done by my beloved colleague, Dr. Krishna. So I will be talking about what is the public health definition. Then I will be talking about what is a public health approach. Then in which what are the core functions and essential services of public health. And at last, I will be talking in brief about what is India's public health system. So the first step, initial, we will start about with what is public health. So there was one famous scientist, that is C.E.A. Winslow, who is considered as a father of public health. And it has defined public health as an science and art of first, initially, we prevent the disease, then we also prolong life, then we promote health through organized efforts of society, number one. Number two, organization. Number three, public and private communities and individual through informed choices. Okay, so what is the meaning of informed choices? So in informed choices, we provide information, that is health information, to the participant, and we empower them to take decisions. So this is a basic and initial definitions of public health. Then there are total, we'll be talking about public health core sciences. So as a public health professional, public health practitioner uses 5 core sciences. Initial, it will start from surveillance. So what is the meaning of surveillance? So surveillance is a basic technique that is used to monitor the current situation. And after that, public health practitioner also use a word which is known as epidemiology. So on basics, epidemiology is a technique that is used to identify that from where the disease has developed, number one. Number two, from how it is spreading from person to person. And number three, we prevent that. So you can say arsenal of public health, that is epidemiology, and confirm the diagnosis of the disease. So public health practitioner uses laboratory lab diagnosis. So it will confirm the disease, and ultimately which will lead to prevention and effectiveness. So while after taking all these core sciences into determination, then we will public health practitioner will prevent and as well as effectively prevent it. And last, and recently there is one more domain which is originated in public health or in healthcare system of India, that is informatics. So informatics means we use ICT technologies, that is information, communication and technology, to analyze and present the data and which can be used for monitoring and evaluation of the entire public health, public health outbreak analysis. Sir, sorry. Okay, so now topic 2 is I will be explaining about what is a public health approach. So in a public health approach means we are going from problem to response. Okay, so while moving from problem to response, we will have to identify 4 main questions. Number 1, first we'll ask what is the problem. So for that, for the solution of this problem, we will use surveillance. Surveillance is a basic technique to monitor any any public health epidemic or outbreak. At this time, you need to get the information at basic level only. And the second question will ask about that what is the cause. So to identify what is the cause, there is one technique in public health which is known as risk factor identification. So by using this technique, we will identify this what is the cause. I will be explaining this public health approach through one example in the upcoming slides. Then the next question we should ask that we have identified what is the problem, we identified what is the cause, and then we will identify that what is the possible solution, what will work, what we have in our arsenal. So there will be intervention and we will evaluate, and at last we'll ask the question on the ground that how do you do it. So this is an implementation phase where ultimately we gives any solution. We go in the field and we provide any solution at the field that comes under response. So this is a public health approach which may move from problem to response. So this was the example which I was talking about. So in 1800s, we all know that there was one disease which is known as cholera. So cholera is an fatal intestinal disease, okay, which spreads through, there are many bacteria, but mainly it's due to sewage contamination of the drinking water. So it's a fatal intestinal disease, and there was an outbreak in London, which has led to hundreds and thousands of deaths at the time of 1800s in London. So at that time, they were thinking that cholera was commonly to be caused by bad air from rotting organic matter. So at that time in 1800s, there was well-known physician which is known as John Snow, and John Snow is also known as the father of modern epidemiology. So John Snow is also best known for he at that time used the public health approach to identify the source of cholera outbreak. And this is the photo, and he was working at London School of Hygiene and Tropical Medicine, which is located in United Kingdom. So how he has done it. So John Snow used this public health approach and convinced the British government that the main source of cholera was water, which was contaminated with sewage, and this pump is still there, present there. Okay, so if anyone get a chance to go at London, you can see that it's still this iconic pump where the first public health approach was used is also present there. Because initially I have talked that they were thinking that cholera was commonly thought to be caused by bad air or from rotting organic matter, but it was an entire different scenario. Now we'll talk about topic 3 of my presentation, that is what are the core functions and essential services of public health. So there are total 3 core functions of public health in brief, and under which there are many essential public health services. So I will be talking about assessment. First core function is assessment. Then second is policy development. And third is assurance. So in assessment, a public health professional will systematically collect, analyze, and make available information on healthy communities. So based on this, we used to update any policy. So their next phase will be policy development. So in policy development, we promote the use of this assessment data, which we have collected, analyzed, and which is available already available in the domain. So we will use that, and which will be our scientific knowledge base. From assessment, we will be getting that, and we will make a policy. And after policy has been designed, so we will implement it. So this is the implementation phase, that is assurance phase. So in assurance, we provide a service to those who are in need. Now, under these 3 core functions of public health, there are total 10 essential public health services. At this point in time, you just need to know what are the 10 essential public health services, because it's itself a great large topic to cover each and every point in detail. So the first, under assessment, we will monitor the health of healthy individual, that is ongoing, systematic, and as well as through surveillance. And then if there is any disease or outbreak, so in second, we will diagnose and investigate it. Okay, so this is the assessment phase, which is the first core function of public health. Then we will talk about policy development, and under which there are total 3 essential public health services. Okay, so the first service is inform, educate and empower. So after we are getting that, for example, if cholera is diagnosed, so we'll inform the newspapers and educate the people that how to prevent it or how to take precautionary measures. Then we will also mobilize the community partnership. What is the meaning of mobilize community partnership? It means that there are various non-governmental organizations, for example, Bill and Melinda Gates Foundation and all. So we will take that helps, or that helps also, and we'll develop policies based on that. For example, in COVID-19 outbreak, so World Health Organization was active taking part in it. So what Indian government has done, so they have taken help of World Health Organization to develop quarantine policies. As we all know that there was 14 to 21 days quarantine period once you are contracted with COVID-19. So this is one of the examples that how the policy has been developed in the past by using the public health approach. Then the next will be last, that is assurance. So in assurance, there are total 5 essential public health services. Now, services. So we will enforce the laws. For example, during COVID-19, you have already seen that when you are going outside, then there was security personnel standing there. You don't have to come out and have social distancing. To enforce that, there was various laws which was provided by Government of India. Then after the first wave of COVID-19, I will be giving example of link to provide care. So right after, as you all know, that the first wave was drastic in India, and there were several deaths. So while taking lessons from that, okay, so our Indian government has developed their health system like anything. So they have developed new oxygen concentrators, then they have increased the beds. So this will come under assurance that government has the responsibility to provide care in terms of outbreak. Then we also have to assure a competent workforce. So in to assure a competent workforce, I think government also has developed training workshops for the healthcare professional in India. So there was a training going on in various departments and all, to that how we can effectively manage COVID-19. And the last 2 steps is research in the part of research. So now currently in a monitoring and evaluation of that approaches has been the reports have been out. So this is the 2 step in which we evaluate, and at last we do a research. Healthcare is always a partner of public health, but there are brief differences in that. So I will be discussing about what is the difference between public health and healthcare. Okay, so in public health, there is population is at the center. Okay, so we have a population focus. And in healthcare, it's a clinically driven treatment. So there is individually and patient focus. So for example, in public health, there is one cholera outbreak. Okay. So in public health, the population focus is that we must chlorinate the water to avoid any further contamination. So this is an example of public health. And in healthcare, that is individual patient focus. So in healthcare approach, for example, if any patient is diagnosed with cholera, so the clinician or the healthcare doctor working in a hospital that provides the treatment to the patient that comes under healthcare. Then in public health, there will be public health ethics, and in healthcare, there will be individual clinic-based ethics. So in public health also emphasis on prevention. Okay, prevention is better than cure is the main motto of public health. And healthcare rolls about after the disease has been diagnosed or after the outbreak has happened. So it will talk about diagnosis and as well as treatment, and also will lay emphasis on new treatments. Okay, in public health, if you are a public health professional, then there will be joint laboratory and on-field involvement. I know that it's very vague early to say what is the Indian public health system as a laboratory perspective, but in public health, there will be laboratory personnel and as well as on-field workers such as ASHA worker and as well as ANM. ASHA is a grassroots level worker which works under the primary healthcare system of India. And in healthcare, there will be patient involvement in that. So, for example, if we are talking about the cholera itself, so if cholera is I want to diagnose cholera under healthcare approach, so I as a clinician will send the patient to a public health to a healthcare laboratory for stool examination, because one of the key diagnosis, or what we can say gold standard diagnosis of is stool culture. So in which which bacteria has been contaminated. So from that, this is an healthcare approach where a patient will go after prescription of doctor to a diagnosis center and will get their stool culture. Okay, and public health as a field is come under public expenditure, that is government expenditure, and healthcare can come under both private sector basis as well as public health basis. And here, in public health, as a public health professional, clinical sciences is peripheral to professional training. So human resource management, organizational behavior, it comes at a central part rather than clinical sciences. But in healthcare, the unit is a doctor. Okay, so for that, clinical sciences is very essential for their professional training rather than management training. So this is also different between a public health cadre and a healthcare cadre. Of course, community physiotherapists will come under public health cadre, but other physiotherapists will come under healthcare cadre. Now, this is important part for everyone. Okay, so I will be talking about the structure of Indian public healthcare system. Okay, so we have private and public mixed healthcare system in India, but my main focus will be today will be of public healthcare system. Okay, private healthcare system is entirely different thing. Their expenditure is also different. Okay, so our public healthcare system is divided at the 3 levels. Okay, the first is the primary level, the second is the secondary level, and third is the tertiary level. Okay, so in primary level, we will be having 2 types of centers. That is primary healthcare centers and sub health centers. Okay, so sub health centers will be at the rural areas, which will cover approximately 3,000 to 5,000 population. It means that there will be one sub health center for 3,000 to 5,000 population. Then if we move towards higher to the hierarchy, then there will be primary healthcare centers, which will cover approximately 20,000 to 30,000 population. Now, what is a primary care level? Okay, so now currently the government has enrolled Ayushman Bharat program. So in which primary healthcare centers and sub health centers will be converted into Ayushman Bharat Health and Wellness Center. Okay, so you must have idea about that how our public health system works. That's all. So in sub health centers, government provides basic necessities such as deliveries, basic level, all the healthcare facilities will be provided by sub health centers and primary health centers. In terms of human resource, in sub health center, there will be one ANM, that is auxiliary nurse midwife, ANM, which we can say, and there will be one multi-purpose health worker, that is male. Okay, so auxiliary nurse midwife is one type of health worker only, which is known as grassroots level worker. So, for example, he will spread awareness about what are the programs enrolled by the government. Then, if there is, he will also help in organizing the immunization day. Immunization is the process which we vaccinate the people, vaccinate the children. I used to say, which is also known as universal immunization program. So all these things of hygiene, then all the basic necessities of person will be provided by ANM, that is auxiliary nurse midwife, and multi-purpose worker, that is female. There will be at sub health centers. Then at primary health center, there will be all treatment of diseases, and there will be a medical officer here. Okay, and the head of the sub health center is CHO, that is Chief Health Officer. So in primary healthcare center, as we are moving upwards towards hierarchy, so more complex treatment here will be available. For example, treatment for diarrhea, treatment for gastritis, treatment for respiratory disease, then treatment for other neurological conditions, which will be at basic level. So this is primary healthcare center. Then as we move towards secondary level, we will have an approach which is known as community health centers, that is CHC. This I would like to again say that this is more advanced than primary health center. So as we are moving towards the pyramid, above the pyramid, means on the top, there are more advanced facilities will be there, and more human resource personnel will also there. So in community health centers, the same what PHC and sub health centers are providing the treatment, same will be there, but additional diagnosis facilities will also be there. So for example, CT scan, that is MRI, then in all it will also cater 80,000 to 1,20,000 population. So this comes under secondary level. And above that, there will be sub-district hospitals. So in sub-district hospital, there will be also cancer care available. So if we are moving above to the pyramid, more complex and more advanced treatment will be provided, and the referral system will also work in the same way. From health center, the patient will be referred to primary health center, then CHC, then sub-district hospital. Okay, now at the final tertiary level, there will be district hospital and as well as the government medical colleges and government hospitals, which is also known as civil hospitals. So once in a while, you have also visited that the civil hospital. So civil hospitals or medical college hospitals are the ultimate highest level healthcare system in public healthcare system. Okay, but in medical college and sub-district hospitals, there can be both private medical college as well as government medical college, private tertiary care hospital, secondary tertiary care hospital. So at the tertiary level, there will be one more will be added. That is, they will also provide rehabilitative care. There will be team level care, or which is also known as CPHC. That is continuous primary health care. Okay, continuum of care will also be provided by medical colleges and hospitals or district hospitals. Okay, and in district hospitals, there will be also IPD, that is inpatient department. There will be ventilators, there will be advanced care. And in medical college or hospital, there will be specific stream based care. For example, one is cardiac care unit, one is neurological based unit, one is musculoskeletal unit. So this is an entire domain in which our healthcare system work, or which means public healthcare system work. Okay, so as a currently, you must know that where a physiotherapist is to be recruited in this pyramid. So currently, physiotherapists are recruited in district hospitals, then sub-district hospitals, medical college and hospitals. And currently the policy changes has been occurring, because as I have already talked that government has enrolled systematically Ayushman Bharat. Okay, so in Ayushman Bharat, they are also thinking to add additional one more healthcare human resource for health in primary healthcare center and as well as sub-health center. So the physiotherapist will also be one of the core grassroots level worker working towards the working in closely with the village or rural population in India. So any questions? I'm open for questions.
If you have any questions, student, you can directly ask to sir, or else you can write in the chat box. You can share your feedback, student. So I guess no question are there from the student side, Dr. Pranav. So
yes.
Thank you,
Questions?
Dr. Pranav, for
any questions
this.
from your side?
No. Thank you, sir.
So these were my additional resources and reading. You can, I will share. I
There is
have
a
already
one
shared you the
chat.
PPT.
It was very good to know about the public health. It is a very informative session. Thank you, Trisha. Student, you can write your feedback in the chat box. Amazing session. Thank you, student, for your valuable feedback. Thank you once again, Dr. Pranav, for your time and concern. And thank you, sir.
Thank you. Thank you.
I am ending this meeting, Dr. Pranav.
Okay. Thank you.
Thank you, student.